Welcome to Concept in Medicine. In today's tutorial, we are going to be looking at the historical landmarks in epidemiology. This is a concept in public health. Let's begin by looking at what epidemiology is. So when we say epidemiology, you should know that it's the study of the frequency, distribution, and the determinants of health, and all that health-related conditions or events in a specified human population, and the application of this study to prevent diseases and promote health. So looking at that definition, there are certain key terms in the definition that are of great relevance to the understanding of epidemiology. The first one is the frequency that we said. When we say frequency, simply it refers to the number of times an event occurs. The number of times an event occurs is what we term as what? The frequency of that event. Then the next term is a distribution. And when we are saying distribution, then it means we are going to be looking at the people, the places, and the time. And when we say people, what are we looking at? Who. When we say who, it means we are referring to what? The people. When we say when, then it means we are making reference to time. And when we say where, then synonymously it is referring to the place. So it tells you that the distribution is by place, time, and people. And that would answer the question of where, that is for place, when, that is for time, and who, that is for people. The next item in the definition that is of great relevance is the determinants of health. And when we say determinant of health, you should know that they are factors whose presence or absence affects the occurrence of a disease, meaning that the absence of such a factor could lead to a disease emanating, or the presence of such factor could lead to the occurrence of a disease. And the question is, what are these factors? For the determinants of health, we can simply remember the factors by using the 5 H's. 5 H. 5 H's. And for the 5 H's, we are talking about the host, we are talking about heredity, we are also talking about the habit, we are also talking about the habitat, and finally health service. So host, heredity, habit, habitat, and health services constitute the determinants of health. Let's take for example health services. If you are sick and in your environment there are no adequate health services to acquire, it means that health services that would promote treatment of the disease, if absent, could lengthen the disease process, and that could lead to a complication which could be death or disability. So the health determinants plays a great role in the development of a disease. Now, with the understanding of epidemiology, we can now move to the historical landmarks in epidemiology. So let's start by looking at the first one. The first one, we are talking about Hippocrates. Hippocrates' contribution came in the year 460 BC. BC meaning before Christ. And what is the contribution of Hippocrates? Hippocrates said that environmental factors and behaviors of women affect health. Whatever that is taking place in the environment, it could be high radiations from the sun, and also woman behaviors. It could be dumping of rubbish in gutters. That could occlude the flow of water, leading to flooding, causing the transmission of infectious agents to human beings. So he said that environmental factors and human behaviors affect health, which is very, very true. And that contribution came in the year 460 before Christ, 460 BC. Let's move on and look at the next historical landmark, and that is coming from John Grant. John Grant contributed to epidemiology in the year 1662. And what did John Grant do? He quantified deaths, births, and diseases. He was looking at the number of deaths occurring in the human population, the number of births occurring in the human population, and the number of diseases, specific diseases occurring in the human population. And that is the contribution of John Grant in the year 1662. So with that, he is also considered as one of the fathers of epidemiology. Let's move on and look at the next historical landmark, and that is coming from James Lind. James Lind, in the year 1747, said that scurvy can be treated with citrus fruits. Scurvy can be treated with fresh citrus fruits. Why did he say that? Scurvy is a condition or disease of a vitamin deficiency, specifically vitamin C, that is ascorbic acid. And fresh citrus fruits are known to contain ascorbic acid. Hence, taking fresh citrus fruits which contain ascorbic acid could help resolve scurvy. So with that, in the year 1747, James Lind made a great contribution to epidemiology, hence considered one of the fathers of epidemiology. Let's move ahead and look at the next historical landmark. That is coming from William Farr, and his achievement came in the year 1839. And William Farr, what was his contribution? He established the application of vital statistics for the evaluation of health-related problems, meaning that he introduced the application of vital statistics for looking at problems which are health-related, and his contribution came in the year 1839. Let's move ahead and look at the next historical landmark, and that is coming from Jon Snow. Please, this is not the Jon Snow from Game of Thrones. This is the real Jon Snow, which is considered as one of the fathers of epidemiology. And Jon Snow's contribution came in the year 1854. And what did he do? Jon Snow tested the hypothesis on the origin of the cholera epidemic. So when it comes to cholera, always think of Jon Snow, because he tested the hypothesis on the origin of the cholera epidemic, where cholera is coming from, what is causing it. That hypothesis was tested by Jon Snow in the year 1854. Because of that, Jon Snow is considered as the father of field epidemiology. Let's look at the next historical landmark, and that is coming from Alfred Lewis in the year 1872. What was the contribution of Alfred Lewis? Alfred Lewis simply systematized the application of numerical thinking. He brought about the use of numbers. He made sure that numerical thinking is put into systems, and his contribution came in the year 1872. Let's move ahead and look at the last historical landmark. These are not all the historical landmarks, these are major ones. For the last one, we are looking at Bradford Hill. Bradford Hill. His contribution came in the year 1937. And what was his contribution? Bradford Hill in the year 1937 suggested the criteria for establishing causation. So when it comes to establishing what could cause a particular condition, Bradford Hill, through his work in the year 1937, suggested the criteria for establishing the causation. I believe we have learned something new in today's tutorial. But before we go, I have a question for each of you to give the answer in the commentary section. And that question is, what is the basic unit of epidemiology? Kindly leave your answers in the commentary section. Kindly make sure to subscribe to my channel, like, share, and also comment the next concept you would like to see in my next tutorial. My name is Dr. Del, and this is Concept in Medicine. Bye-bye.